children and young people need not to be an afterthought. Too often, children and young people have been thought about after adults have been thought about and their needs have been attended to. So first of all, we need to think about how we ensure that we diagnose children early and we get them onto effective treatment early. And that means the most effective treatment that is available to them. They should be having the opportunities for the optimal treatment and care that adults get often before they do. Secondly, we need to think about how we empower children and young people from a really young age so that they can own their own health, that they have their own health information, and that they can be an active participant in how their care is provided to them. And their voice is really strongly heard from the beginning as to what their needs are and how those needs can best be met. And one of the key issues we still have, and we've always had, is younger children not knowing that they have HIV, even though they're in treatment and care. And it's really not acceptable anymore when we've had children's rights for such a long time that children aren't empowered to be in control of their own health information and how they access their treatment and care. It's also critical that we think early about what lifelong care looks like. Children and young people growing up with HIV today are likely to have HIV their whole lives, and we need to think about that lifetime of care early, rather than think that we can just kind of push them through to adulthood and push them through to adult care seamlessly without really giving clear thought and understanding to what support they might need during that transition. And that means talking to young people and involving them in care decisions and helping inform those developing services through the voices of young people. Young people are very able to articulate themselves in terms of what they're going to need, particularly in that critical time when they move from pediatric to adult care. We talk about youth specialist provision, and we really need to think about that as a key part of the care pathway. There are children, there are adults, but there are young people, and actually young people's differentiated care, specialised care, can be really effective in supporting young people in those transition years to make sure that we don't lose them and that young people stay engaged in care, because there's a big risk that young people can fall out of care during that period of time when life becomes really different for a child moving into adulthood.